So a trigger finger is a painful condition affecting the hand. Often patients will describe it feeling like their finger gets stuck, and this is common first thing in the morning, and they physically have to straighten it again with the other hand. It can often start off with a painful lump in the base of the finger around the palm of the hand. So through this sort of region here, painful lump may develop, and that may be the start of the trigger finger. Then that may progress to just stiffness, bending the finger up and down, or it could progress to what's called triggering of the finger, where it feels like it pops and gets stuck in flexion, and then as you're trying to straighten it out, it pops again. So that's the true trigger finger. Medically, it's known as stenosing tenosynovitis, which sounds quite complicated. But here's how the whole thing works. So when we have our flexor tendons, to make our hand grip, we have the tendons running down through our fingers, which is represented here by my orange string. Now it runs down to the tips of the fingers to bend the fingers. So some of these tendons will go all the way down there. Now you'll notice that when I pull on these, we get bowstringing of those tendons off the bones of the hand. And that's not very economic for the tendons, and it also creates not a very good lever arm, if you like. So what the body has done is it's created these pulleys that hold the tendon flat against the bone. So you'll notice on this finger here, when I'm bending that finger down, the tendon stays nice and close to the bone, which is a much stronger position for it to be working in. Now the problem arises in trigger fingers when we have a problem at one of these pulleys. Most commonly, we're either going to see thickening of a pulley, or we're going to see some sort of bunching of the tendon or swelling in the tendon. So here I've put a little bit of tape around one of those strings to represent how that tendon might bunch. Now that's going to struggle sliding through one of those pulleys. And that bunching of the tendon, or a little nodule of the tendon, is the thing that gets stuck and causes the popping as it flicks either side of the pulley. So the treatment may involve, in the first instance, trying to identify the things that are causing the irritation. So if you're doing something repetitive that's involving a lot of gripping, it might be the pressure from that thing that you're gripping. So that could be a pair of secateurs if you're a gardener, or some sort of tool if you're a plumber, or maybe in the case of rock climbers, you're specifically gripping it in a way that's loading those particular tendons. Now, once we've identified that, we may rescue from that, or we could even try splinting to try and keep the tendon nice and straight and stop it sliding through for a period of time to reduce the inflammation. Some oral anti-inflammatories may help reduce the inflammation. If it doesn't, there are other options. If we proceeded to an ultrasound-guided injection, we would be looking to inject a small amount of steroid and local anesthetic right at the site of where the triggering is occurring. So that may be into the palm of the hand or at the base of the thumb. The idea behind that is to reduce that inflammation in the tendon sheath and around the pulley to allow normal free gliding movement to the tendon again. After a steroid injection, within a couple of weeks, we should expect hopefully a resolution of the triggering, and the tendon can slide through much easier again.